Hello, my name is Stephen Kehoe, and my capstone project is titled Developing Standardized Simulation-Based Case Studies for Emergency Medical Technician Students. This project represents the work I completed throughout the Healthcare Simulation Leadership Program and focuses on improving the consistency and realism and educational value of simulation activities used in EMT education. The emergency medical technician course I teach at Mount San Jacinto College is a 6-unit, 1-semester program. Each class includes approximately 30 students, many of whom begin the course with little or no previous medical experience. After completing the program and passing the National Registry of Emergency Medical Technicians examination, NREMT, these students may begin working as an entry-level 911 responder. Because EMT students must develop a large amount of knowledge and many hands-on skills in a relatively short period of time, simulation-based education is especially important. Classroom instruction and isolated skills practice can teach individual concepts, but they do not always prepare students to combine patient assessment, communication, clinical decision-making, technical skills, and teamwork during a realistic emergency. Simulation matters because EMT students need more than classroom knowledge and isolated skills practice. They must be able to combine patient assessment, clinical decision-making, communication, teamwork, and technical skills during stressful and unpredictable emergencies. Simulation creates a realistic but controlled environment where students can practice caring for patients before they are responsible for someone in the field. It gives them permission to make mistakes, recognize gaps in their performance, receive feedback, and try again without placing an actual patient at risk. It also helps students connect what they learn in lectures and textbooks with what they must physically do during a patient encounter. Through repeated simulation-based practice, students become more comfortable organizing an assessment, communicating with patients and team members, selecting appropriate interventions, and responding when a patient's condition changes. Ultimately, simulation helps students move from simply knowing the steps of a skill to understanding how and when to use those skills. This repeated practice develops confidence and improves clinical readiness and better prepares students for their first real patient encounters. This project is relevant to healthcare simulation because standardized case design can improve the quality and consistency of the learning experience. It can also provide students with a psychologically safe environment in which they can practice and make mistakes and receive feedback and build confidence before caring for actual patients. Ultimately, the goal is to help EMT students move beyond memorizing individual skills and become better prepared to apply their knowledge during realistic and unpredictable emergency situations. My capstone project addresses this need through the development of standardized simulation case studies. These topics were selected because they include both common patient care responsibilities and less frequent high-risk emergencies. For this capstone project, I selected 6 simulation cases that represent both the most common responsibilities of an EMT and several of the highest risk emergencies that they may encounter. The first 4 simulations focus on the primary and secondary assessments of a medical and trauma patient. These assessments skills are the foundation of nearly every patient encounter. EMT students must learn how to identify immediate life threats and gather relevant information, and perform a focused assessment, interpret vital signs, form an appropriate field intervention, and begin necessary treatment. The final two simulations in my Capstone project address emergency childbirth and cardiac arrest management. Although EMTs may encounter these situations less frequently, both require rapid decision making and strong communication, teamwork, and accurate performance of critical interventions. Because these events are high risk and may not occur often during clinical or field experiences, simulation gives students an important opportunity to practice them in a safe and controlled setting. Together, these 6 cases allow students to develop routine assessment skills while also preparing for rare but potentially life-threatening emergencies. They provide a balanced foundation for improving clinical judgment, communication, confidence, and readiness for real patient care. The methodology for my Capstone project involved developing 6 organized and standardized simulation cases for EMT students at Mount San Jacinto College. I selected cases that represent both commonly performed patient care responsibilities and less frequent high-risk emergencies. Each case was developed using the 11 simulation design criteria described in the Healthcare Simulation Standards of Best Practice. I also aligned the cases with EMT education expectations, the psychomotor skills required in the MSJC EMT course, and the practical responsibilities students will face when they begin working in the field. My goal was not simply to write 6 scenarios. I wanted to create complete, repeatable learning experiences that included preparation and measurable objectives, realistic patient care situations, structured facilitation, participant evaluation, and reflective debriefing. The 6 simulation cases were selected because they represent 2 important areas of EMT practice. The first 4 cases focus on medical and trauma patient assessments. These are fundamental responsibilities that EMTs perform during nearly every patient encounter. Students must learn how to identify immediate threats, obtain relevant information, perform focused examinations, interpret vital signs, develop a field impression, and determine appropriate interventions and transport priorities. The emergency childbirth and cardiac arrest cases represent situations that occur less frequently but require immediate and organized action. Students may complete their EMT education without encountering either situation during clinical ride-alongs. Simulation gives them an opportunity to practice these high-risk events before they are responsible for managing them during an actual emergency. Together, the 6 cases address both the everyday responsibilities of an EMT and emergencies in which limited experience could have serious consequences for patient care. I used a consistent development process for all 6 simulation cases, guided by the Healthcare Simulation Standards of Best Practice. This framework ensured that each scenario was intentionally constructed, educationally sound, and also aligned with evidence-based simulation practices. Each case begins with an identified educational need and clearly defined measurable learning objective. In alignment with the HSS OBP design criteria, these objectives are written to be specific, learner-centered, and observable, describing what students should demonstrate in areas such as patient assessment, clinical reasoning, communication, prioritization, technical skills, teamwork, and reassessment. This ensures that every element of the simulation directly supports intended outcomes rather than incidental learning. I then selected the simulation modality, equipment, patient presentation, and level of fidelity based on the HSS OBP emphasis on aligning design elements with learning objectives. This includes ensuring that the chosen fidelity, whether low, medium, or high, appropriately supports the cognitive and psychomotor demands of the scenario. The design also considers environmental realism and resource availability while maintaining educational effectiveness. Each case includes a structured pre-briefing, which follows HSS OBP recommendations for establishing psychological safety and learner engagement. The pre-briefing outlines expectations, clarifies roles, reinforces confidentiality, and orients students to the simulation environment and equipment. This step is essential for reducing learner anxiety and promoting active participation, which the standards identify as foundational to effective simulation learning. Each scenario is then developed as a progressive clinical experience, incorporating realistic patient cues and decision points. In accordance with the HSS OBP design criteria, the scenario is built around a clear storyline with embedded triggers that respond to learner actions. Facilitator instructions specify when and how information is delivered, and how the patient condition evolves, and how the scenario should adapt based on clinical decisions. This ensures consistency and delivery while allowing for dynamic learner-driven progression. The cases also incorporate structured evaluation methods aligned with the HSS OBP emphasis on formative assessment and feedback. Performance is assessed using defined criteria linked directly to the learning objectives, ensuring transparency and consistency. In addition, each simulation includes a planned debriefing process grounded in reflective learning principles. The debriefing is structured to encourage self-assessment, critical thinking, and the integration of clinical reasoning, which the standards identify as essential for knowledge transfer and skill development. Finally, each case undergoes pilot testing and iterative revision, consistent with the HSS OBP recommendation for continuous quality improvement in simulation design. Feedback from facilitators and learners is used to refine scenario flow, clarity of instructions, and alignment with objectives. Using the HSS OBP design criteria throughout the development process ensures that all 6 simulation cases are consistent, evidence-based, and comparable across all student groups. This structured approach enhances reliability and improves learner outcomes. The 6 simulation cases were designed to align with both national EMT education expectations and the requirements of the Mount San Jacinto College EMT program. National EMS education standards provide a common framework for the knowledge, skills, clinical judgment, and scope of practice expected of entry-level EMTs. My simulation cases support these expectations by requiring students to assess patients systematically, recognize immediate threats, gather relevant information, make appropriate treatment decisions, communicate effectively, and continually reassess the patient. The cases also directly support the psychomotor skills students are required to demonstrate within the MSJC EMT course. Medical and trauma assessment simulations allow students to practice the complete patient care process rather than performing individual skills in isolation. Emergency childbirth and cardiac arrest management provide structured practice for high-risk emergencies that students may not encounter during their limited clinical ride-along experiences. Each simulation includes measurable objectives, expected learner actions, facilitator guidance, and evaluation criteria. This creates a more consistent method for determining whether students are meeting course expectations. It also helps ensure that different groups of students receive comparable learning experiences, even when simulations are facilitated by different instructors. By combining required technical skills with communication, teamwork, clinical decision-making, and patient safety, the cases help prepare students not only to complete the MSJC course and take the in our EMT exam, but also to begin functioning as safe and competent entry-level EMTs. The project combined healthcare simulation research with my practical experience as an EMT instructor and a retired firefighter paramedic. The practical application came from observing the EMT or the challenges that EMT students experience in the classroom and skills laboratory. Students may be able to memorize assessment steps, but still struggle to organize those steps during a realistic patient encounter. They may also have difficulty connecting a chief complaint with the correct body system, interpreting vital signs, communicating with patients, selecting interventions, or transitioning from the primary assessment to the secondary assessment. The simulations were designed to place these skills into realistic situations. Students must gather information, communicate with the patient and their partners, recognize important findings, make decisions, perform appropriate interventions, and reassess the patients. This approach allows students to practice the complete patient care process rather than performing isolated skills. It also creates a practical simulation toolkit that can be reviewed by faculty, pilot tested with learners, revised through feedback, and incorporated into the MSJC EMT curriculum over time. Developing these 6 EMT simulation cases helped me better understand that an effective simulation requires much more than simply creating a patient condition and asking students to respond. Each case must be purposefully designed around identified learner needs and measurable objectives and realistic clinical progression, along with appropriate facilitation and evaluation and debriefing. One of the most important findings was that structure and standardization do not make simulation less realistic. Instead, they help ensure that each student receives a comparable and meaningful learning experience. Standardized cases also allow instructors to evaluate student performance more consistently and identify areas in which learners need additional practice. The project also reinforced that simulation is most valuable when it helps students connect the knowledge they learn in the classroom with the actions they need to perform during actual emergency patient care. A major finding from this project was the value of standardized case design. Without a written structure, the same simulation may be presented differently by different instructors, or even differently by the same instructor from one class to another. Each of the 6 cases includes a defined starting point, patient history, assessment findings, vital signs, expected learner actions, instructor cues, and an endpoint. This structure increases repeatability and helps ensure that differences in student performance are more likely to reflect learner actions rather than changes in how the simulation was presented. The healthcare simulation standards of best practice emphasizes that scripts, clinical progression, cues, timeframes, and critical performance measures should be established during the design process. These elements improve consistency, reliability, and alignment with the learning objectives. Standardization also makes the cases practical resources for the MSJC EMT program because they can be reused and reviewed by faculty and pilot tested and improved over time. The development process also demonstrated that the facilitator plays an important role in determining whether a simulation becomes a meaningful learning experience. Even a well-written case can become ineffective if the facilitator provides too much information or gives inconsistent cues or changes the scenario unnecessarily or creates an environment in which the students are afraid to make mistakes. Each case, therefore, includes a structured pre-briefing that explains the learning environment, expectations, confidentiality, available equipment, and the basic assumption that students are capable learners who are working to improve. This helps establish psychological safety and allows students to focus on patient care rather than worrying that the simulation is designed to embarrass them. Facilitator cues are planned in advance and are intended to redirect learners only when necessary. This supports students who, uh, this supports students while still requiring them to assess the patient and communicate and make decisions and take appropriate action. The simulation standards or design standards identify pre-briefing and learner-centered facilitation and plan debriefing as essential components of an effective simulation-based experience. Another important finding was that simulation provides opportunities to evaluate much more than the completion of an individual psychomotor skill. EMT students must be able to gather information, interpret findings, communicate with patients, assign roles, prioritize treatments, make transport decisions, and reassess the patient. The medical and trauma assessment cases require learners to move through both primary and secondary assessments while connecting the chief complaint or mechanism of injury to the appropriate focused assessment. Students must recognize immediate threats, interpret vital signs, develop a field impression, provide appropriate interventions, and determine whether rapid transport is needed. Simulation also makes communication and teamwork visible. Instructors can observe whether students explain procedures to the patient, communicate findings to team members, delegate responsibilities, listen to one another, and maintain a shared understanding of the patient's condition. Through repeated practice and reflective debriefing, students can become more confident and better prepared to care for real patients in unpredictable pre-hospital environments. The 6 cases represent 2 very different areas of EMT practice. Medical and trauma assessments are performed during nearly every patient encounter. These cases emphasize the development of reliable habits, organized assessment, communication, and the ability to recognize important findings without becoming overly dependent on memorized checklists. Emergency childbirth and cardiac arrest occur less frequently, but both require immediate and organized action. Students may complete their EMT education and clinical ride-alongs without ever participating in an actual field delivery or cardiac arrest resuscitation. Simulation, therefore, provides an important opportunity to practice these high-risk events before encountering them in real patient care. Developing the rare event cases required greater attention to role assignments, timing, equipment preparation, critical actions, and scenario progression. In cardiac arrest, students must coordinate CPR, ventilation, AED use, and team communication. During emergency childbirth, they must prepare for delivery, support the newborn, recognize complications, and communicate calmly with the patient. This comparison reinforced that common skills benefit from repetition, while rare emergencies benefit from deliberate rehearsal that prepares learners to respond under pressure. Although these cases have not yet undergone full formal implementation and outcome testing, their development was guided by observations from teaching EMT students at MSJC. Students often learn the required assessment mnemonics, but may have difficulty using them as part of a natural and organized patient interaction. Some learners can recite assessment steps, but struggle to connect the patient's chief complaint to the correct body system, focused examination, field impression, or treatment plan. Communication is another recurring challenge. Students may perform the technical portions of an assessment, but forget to introduce themselves, or explain procedures, or obtain a clear history, or reassure the patient, or communicate their findings to their team members. The cases were designed to make these areas observable. For example, the secondary medical assessment case requires students to move beyond the primary assessment, obtain an OPQRST and sample history, select appropriate focused examination, interpret vital signs, form a field impression, and explain appropriate treatment and transport decisions. The project, therefore, produced more than 6 clinical scenarios. It created a structured method for identifying performance gaps and providing targeted feedback through evaluation and debriefing. Formal learner results are not yet available. Pilot testing, faculty review, and collection of learner and instructor feedback remain important next steps for full implementation consistent with criteria 11 of the simulation design standards. As I reflected on faith integration throughout this project, I kept coming back to Jesus Christ as the greatest teacher of all time. Christ certainly taught directly, but some of his most memorable lessons were taught through parables. In Mark chapter 4, verse 2, we read that he taught them many things by parables. These were stories built around situations people could understand. Rather than simply giving his listeners information to memorize, he placed them into a situation and encouraged them to think about what it meant and how it applied to their own lives. In many ways, I see a connection between Christ's use of parables and simulation-based education. A simulation is also a story. We create a realistic situation, place the learner into it, and ask them to make decisions. The learner has to interpret what is happening, decide what is important, take action, and then consider the consequences of those decisions. This has been one of the central purposes of the 6 EMT cases I developed in this capstone, to move students beyond simply memorizing steps and mnemonics and help them learn to think and respond when faced with a realistic patient care scenario. I also see a strong connection between the way Christ taught and the importance of self-reflection and debriefing. Christ frequently used questions rather than simply providing the answer. His question caused people to examine what they believed, why they acted as they did, and what they might need to change. That same principle is central to simulation debriefing. In my cases, learners are asked questions such as, what went well? What would you like to improve next time? And what was your thought process when you were deciding to do such and such? The healthcare simulation standards of best practice similarly describe guided reflection as an opportunity to explore critical elements of an experience in order to gain understanding and insight. Another scripture that I've used previously along this topic is Matthew 4, chapter 23, which describes Jesus going throughout Galilee teaching, preaching, and healing. I think those 3 ideas are especially meaningful in healthcare education. Christ's ministry demonstrates that teaching and caring for people were closely connected. As an EMT instructor, I may not personally care for the patients that my students will eventually encounter, but I have the opportunity and the responsibility to prepare those who will. I've also previously connected John chapter 10, verse 14, which says, I am the good shepherd and I know my sheep, with the importance of truly knowing the people that we're trying to help. That applies to education as well. Effective simulation is learner-centered. The facilitator has to understand the learner's experience, abilities, strengths, and needs, rather than treating every student exactly the same. The simulation standards reinforce this by directing facilitators to consider learners' knowledge and experience and to create psychologically safe environments characterized by mutual respect. Ultimately, my faith reminds me that being an educator is more than teaching someone how to pass an EMT examination. It is an opportunity for me to serve. The students I teach today may soon be caring for someone during the worst day of that person's life. I believe I have a responsibility to prepare them as thoroughly as I can. Through simulation, reflection, patience, compassion, and high expectations, I hope to follow in a small way the example of Jesus Christ the master teacher, and help EMTs who are not only clinically competent, but also who treat every patient with dignity and compassion. This capstone project brought together the major concepts I have learned throughout the healthcare simulation leadership program and applied them to something directly relevant to my work as an EMT educator. The final project consists of 6 standardized simulation cases addressing medical and trauma patient assessment, emergency childbirth, and cardiac arrest management. Together, these cases represent both the skills EMTs perform routinely and the high-risk emergencies they may encounter only rarely. Developing these cases reinforced for me that effective simulation involves much more than creating a realistic scenario. Each experience must be intentionally designed around identified learner needs, measurable objectives, appropriate fidelity, structured facilitation, psychological safety, evaluation, debriefing, and continued revision. These principles are reflected throughout the healthcare simulation standards of best practice and become the framework for all 6 cases. One of the most important lessons from this project is the value of standardization. Informal off-the-cuff scenarios can provide useful practice, but they may vary considerably between instructors and learning groups. A standardized simulation gives students a more consistent opportunity to practice assessment, communication, decision-making, teamwork, and technical skills while allowing faculty to evaluate performance using the same expectations. This was an identified need throughout the medical, trauma, childbirth, and cardiac arrest cases. The project also strengthened my belief that simulations should not simply prepare students to pass a skills examination. Its greater purpose is to prepare them for the uncertainty and responsibility of actual patient care. EMT students need opportunities to make decisions, experience stress, communicate with others, make mistakes safely, receive meaningful feedback, and reflect on what they would do differently the next time. That process helps bridge the gap between knowing the steps of an assessment and being able to apply them when a real patient is depending on them. Moving forward, I recommend that these 6 cases be pilot tested, reviewed by other EMT faculty, and revised using feedback from both instructors and learners. Over time, the same standardized approach can be expanded to additional EMT competencies, eventually creating a larger simulation toolkit that can be incorporated throughout the MSJC EMT curriculum. Ultimately, this project has reinforced my belief that simulation-based education is not in addition to EMT education. It is an important way of preparing students for practice. If these simulations help students become more organized in their assessments, more confident in their decisions, more effective in their communication, and better prepared to care for real patients, then the project has accomplished its most important purpose.